Professor Jotham Micheni, and I am the chairman of the Board of Management or the Hospital Management Board, PCEA Chogoria Hospital. And I must say that we are dealing with a hospital that was established a long time ago. It will be 100 years towards the end of this year, 2022. That means it was started in 1922. Now, this hospital has a very rich history, that dates back even before 2022, because it was established by the missionaries of the Church of Scotland that later became the Presbyterian Church of East Africa. To date, we can say that this hospital started from very humble beginnings. At that time, the commonest diseases were infectious diseases, tropical diseases. And I can mention one or two. There was a rampant presence of smallpox, which is a disease of viral infection. There was leprosy in this region and a lot of tuberculosis and other tropical diseases like malaria and other infectious diseases like typhoid. And so this hospital was started basically to look after kind of disorders or diseases. And I do remember that there used to be a small vaccination center. That's where people used to get their vaccinations for smallpox. Those who have lived long enough in this country will remember it was a disease which used to cause a lot of pimples on the face and in the body. It was a killer disease. So Chogoria Hospital then was started by the missionaries in order to address those kind of diseases that were rampant in the community. Now, this hospital will be 100 years in the end of this year, be 100 years age. Therefore, this is our centennial year. But more importantly, we want to say that we have had very many milestones of development. And in this, we want to recognize the great support that this hospital received from the Church of Scotland in regard to providing us with doctors. I will remember there was a founding doctor, was Dr. Clive Irvine, and later on was succeeded by his son, Dr. Geoffrey Clive Irvine, popularly known as GCI. And the support from Church of Scotland cannot be underrated because they brought doctors, they were specialists, and even the construction of the hospital contributed a lot by those partners from Europe. I might mention here that even the local communities also had their share in helping the hospital to grow, and one such occasion is the Harambee that was undertaken in 1970 in this hospital. And this Harambee, which was graced by none other than His Excellency President, then the founding father of this nation, His Excellency President Jomo Kenyatta. I will remember that Harambee also was partly funded by the government of Kenya, national government of Kenya, as well as the German government, and the local community also greatly contributed this particular initiative, and that was the initiative to build the new hospital. If you look at the hospital, you'll find buildings that have been built with small little stones that it looks very unique. Those are the buildings that were constructed in around 1970, during that period after the Harambee that was spearheaded by His Excellency the President. What was the reason why that was done is because the hospital was still very small. It had a small bed capacity, and therefore it expanded from about 50 beds to the current about 312 beds. We are celebrating 100 years of existence, and we want to inform people that this hospital had its own developmental milestones, and I must say that as time went by, the population of the surrounding communities, the population in the Greater Meru, the population in Tharaka Nithi, and the country in general kept on increasing. And therefore, the hospital started getting overstretched, and we must say that the development that took place in 1970 was one of the greatest milestones. The second thing is that in order to meet and respond to the needs of the community, the developing community. There have been a lot of things that have changed in the healthcare sector. There have been some emerging and re-emerging diseases. And therefore, there is no way we could have continued operating the same way. We needed to strategize, we needed to understand what are the needs of the clients that come to us on a regular basis. And that gave birth to a strategic plan that was first put in place in 2016. Between 2016 and 2020, the first strategic plan was developed by the board that was in place, alongside with the management, the senior management, the hospital administrative team.
PCEA Chogoria Hospital has been here for the last 100 years, providing general health care to our communities. The catchment for PCEA Chogoria is a wide one, stretching from Tharaka Nithi counties, Meru, Embu. Also, we get patients from as far as Marsabit counties. For the last 100 years, PCEA Chogoria Hospital has made a big mark in the provision of health care, as it has remained as the main referral hospital for Eastern region for clients seeking health care. It has provided general care in all areas, in surgery, medical, pediatrics, ops, gynae, and for a while, Chogoria Hospital has taken a direction of a more specialized role, so that it remains a referral hospital for this region. In that regard, the hospital has put in specialized services in areas of renal care, such as 18 units, and operating 24 hours throughout the week, even public holidays. It's serving patients from the catchment. It's been a good service because referrals no more to other health facilities. We have also introduced critical care units. This is ICU and HDU for patients who require more care and patients who require to be put on machine. In 2019, towards the close of 2019, come 2020, this hospital experienced a challenge of what the world was facing as COVID, and the hospital was able to stand on its role very quickly and introduce a COVID center, which was a model for this Eastern region, and it was a handy service for the patients that came seeking for this service. Currently, the numbers are low. We are not having any clients in the hospital for COVID, and we hope there is no other wave that will come in that regard. PCEA Chogoria Hospital has another role as a teaching hospital. We have been training nurses since 1951, and our nurses are good. They are recognized all over the country as well as outside this country internationally, and the school has grown in that regard. And recently, the hospital decided to diversify the courses offered there, and the college has changed from Clive Irvine College of Nursing to Clive Irvine College of Health Sciences, looking at other medical courses that will help improve in service delivery to our clients. The hospital also has been a training center for interns since the 90s, and every year we graduate more than 15 interns, medical interns, and also in other fields of clinical medicine and general medical areas. In the last 4 years, the hospital has also gone to residency programs and introduced the family medicine residency program in conjunction with Kabarak University, and we are proud to say that we've already graduated the first group of residents in family medicine. Also, 2 years ago, the hospital worked towards general surgery and introduced a residency program in the field of general surgery, and our residents are in the second year of training. We are going forward, taking a strategic direction where we want to step further the services and lay our focus on improving service delivery with a customer focus, where we want our clients to have very good experience as they pass through this hospital in several areas. And as we build that client experience, we want to invest in our staff, all our human resources, as we build their capacity as second focus area. And once we build capacity in our staff, we are assured of very good customer experience as they pass through several areas of service delivery. Since this hospital is quite old, it's over 100 years, this year is when we attain our 100 years, our infrastructure is quite aging, and many parts of this hospital require looking at, renovating, bringing down some old structures and putting modern new ones, focusing on that area where we want to invest in our infrastructure as we renovate areas, facelift others, and do new buildings. As we also look at equipment and machines that deliver care to our patients. We have undertaken a huge project also in infrastructure development or delivery of oxygen, so that we ensure that we have enough for our patients. As we got a challenge during the COVID service, we decided on embarking on this important infrastructure to ensure that our patients get the best of care. So to do all that, what we have said, the hospital is also focusing on financial sustainability. And this, as we know, much of our income comes from our patients. And for us to be able to retain our patients, we are looking at how we care for them. And that is why we have developed a slogan going forward of caring with love, so that the care that we are giving, and it's care that is all around, these patients will be able to like our hospital, and we will have continued support from the communities as they come to seek for health care. And as we also sustain our finances, we are looking at additional services that we want to increase or improve in specialized areas like oncology, like many services in different areas that we even source for service elsewhere. We want to improve our lab so that it's able to accommodate all the lab services that we are offering to our clients. And for that financial growth also, we are improving our radiology department, and recently we've been able to introduce MRI services as well as CT services. And going forward also, as we look at that area in our strategic direction, other services that we want to introduce there is like the mammograph for women and other tests that people go to look for elsewhere. So we are calling upon the community for their support and for utilization of services in this hospital, because this hospital has improved a lot in the recent years. And we have tried to put the relevant personnel in all areas. We have consultants in all fields. In surgery, we have general surgeons that are experts in their fields. We have a full-time surgeon in orthopedic, full-time pediatrician, a full-time obstetrician, and a full-time internal medicine physician, as well as family medicine doctors. So we are proud to say that in the last 100 years, we've been able to remain the main healthcare provider in Eastern region, and we shall continue serving our communities and improving as need be. We call upon the community to always give us feedback, as they also support us on where to improve, and we assure them of quality healthcare services. Thank you for visiting PCEA Chogoria Hospital. PCEA Chogoria Hospital, caring with love.
Again, strategic plans are living documents, so this has been revised mid-term, and as a result, after 2020, we have developed another strategic plan to take this hospital from 2022 up to 2026. I want to capture the main thematic areas, the main areas of our concern. Having analyzed the hospital, done a SWOT analysis, tested analysis, those are just analysis to know where we are and decide where we want to be. The hospital then came up with a number of thematic areas, and I'll just mention them and explain very briefly what they are all about. The hospital is about caring for people who come in with problems, that is health problems. As a result, the first one is a patient-centered thematic area where we want to achieve the highest clinical care standards and service delivery. This is in keeping with the national theme where the health sector aims to give Kenyans, the citizens of Kenya, the highest possible clinical care. And therefore, when we say everybody in Kenya has a right to access health care, then this hospital is committed to ensuring that all our clients receive the highest clinical care in terms of standard.
PCEA Chogoria Hospital is 100 years old this year. It was established in 1922 from some missionaries who came from Scotland, who found that this place needed a hospital, or a place where people are seen and reviewed and treated without having to travel long distances. These people had come from Tumutu, where they had seen the success that the establishment of a PCEA hospital had done to that community there. So coming here, it started with a small place. There's a small green building, first clinic at Chogoria. And since then has had times when it had, most of the early times before independence, had one doctor and probably a nurse or two. But then soon after has grown to the time when it was handed over to the local church, that is the PCEA church. That happened. The model was now changed to be a bit more self-sustaining, because before that it was very much dependent on donations that came from Scotland. There are challenges that come with that, because you see, human resource and infrastructure don't come cheap. So challenges, like I mentioned, infrastructure and human resources are capital intensive things. They involve a lot of money. And when you are aiming to be self-sustainable, you have to balance it. Because you see, first of all, we are faith-based. So our agenda is not really to make money. We are non-profit entirely. The second thing is that we are in the ministry. We are part of the ministry of Jesus Christ. We are supposed to spread love. We had to balance between coming off as looking for money and spreading the love of Jesus Christ. And yet, at the same time, improve the care that we are giving. You see, we could not continue having medical officers managing patients in this place. This is modern Kenya, and this hospital, being the biggest in this region, had to take its place, which means to set the standards. And so we had to get specialists on board. During the early 2000s, initially we had maybe 1 or 2 consultants. Right now we have about 10 consultants, and we have every field of medicine, pediatrics, surgery, and family medicine, as well as obstetrics and gynecology covered with specialists. We are even now looking at subspecialization, and that part of human resource also does not come cheap. But also it comes with additional resources, because you see, when you get an orthopedic surgeon to be full-time here, you have to have infrastructure resources that can allow that skill that he has to be utilized in this place. You cannot just bring them and have an X-ray. You need a CM, which is basically a special X-ray that is done in the operating room. You need what we call arthroscopy equipment. You need many things. You need a supportive department of physiotherapy that's vibrant. That's just one example. That's orthopedics. But then there's also medicine, for example. You have to have a lot of things. And so it's been challenging, let me say that. But God has been faithful, because I can say, as of now, there's no consultant who feels underutilized in Chogoria Hospital. They are all happy, and if you look at our turnover for specialists, you will find that this is because of the working environment that we provide for them. We, on the converse side, if you look at the patient side, is that now we are able not to refer patients and to take care of a majority of our patients who come to Chogoria. They've come from smaller hospitals, smaller referral points, and they've come here because they want to get the highest care they could. And so I can say, as at 2022, we are not disappointing these patients. We have everything that's required of a level 5 hospital. We do a bit much more than that. For example, I can tell you for sure that in the field of renal care, Chogoria is the king among the faith-based. We are the first to have a successful dialysis unit, and to be able to expand it to include even an ICU with dialysis beds. And so we are actually the reference point. All the mission hospitals, including the big ones, come here because they want to learn from us. So I can say Chogoria is taking its place where it belongs, which is the vision that was present with the founders, because they wanted this institution to be a beacon of light in this region, to be a place of hope, a place where Christ is glorified. And so I think in the last few years, the challenges we've had in terms of maybe some cash flow because of National Health Insurance Fund and all that. There's also hope that things will be better, especially with the new law that has been put on for NHIF. And so everybody feels motivated, and everybody is looking forward to where we will be in the next level. So financing is key, like I mentioned, because we don't depend on donors. But I can say we have partners. This play a huge part, because like I mentioned before, sometimes, especially when there's issues with cash flow, the infrastructure aspect can lag behind. And so our dear partners help us on that, and we are able to achieve the same objective, because the partner's objective is also to serve God through what they have and through what they make. And so if we share that vision, then we are able to move forward. And we have a strategic plan that we are launching this year in 2022 that plan sees us in the next 5 years moving forward in the direction that we have already taken. Like I mentioned, we want to move to sub-specialization to be able to offer services that are not available in this region. We, as I mentioned, we are the reference point is renal care. We want even to take it further. And by the end of this term, we see that patients will get renal transplants in this place. We'll have a program that will be able to do this possibly using NHIF. And I think that will be valuable to our patients. You see, when we expanded our dialysis unit, we did not expect that the need would be that great. And so we've had to increase the beds. And even now, we're actually planning to even increase them further because of the need that is there. There are many patients who have renal disease, and most of them, before this, it makes me concerned where they were going, but they were probably not surviving for a long time because they could not get this care at a convenient way. You know, you had to go to Nairobi and go to Kenyatta, get a big line and all that. It would be troublesome. So right now, if you can come to Chogoria, you will not miss a session. You will be able to be taken care of. And once we reach the maximum for the beds we have, we still have space to increase further because we built a beautiful unit that I think everyone should look at it. It's actually a center of excellence. And like I mentioned before, all the mission hospitals are coming to learn from it so that they can establish their own. So the field of neonatal care, we are growing as well. Surgery, there's no question about it. Chogoria has been a leader for many years, and it's an area that we are the referral place. And for that, we have really invested hugely in the surgical service so that we take care of patients who need that service. We have a total of 6 operating units, 4 major, 1 endoscopy, and 1 minor theater. We do endoscopies on a daily basis. We do surgeries of 24/7. Our major surgery rooms are able to do any surgery that needs to be done because they have been made for highly specialized surgeries. Our doctors are very well trained. The equipment there is world class. I could tell you, like this region of Mount Kenya, if you come there and you look for our laparoscopy equipment, it is nothing matches it among the faith-based. Again, but our unit is stands out. It's high quality. The image is excellent. We have been able to help many patients as far as from Nyeri, from Isiolo, even far from Masabit. I think they benefited because of that investment. And again, these developments have been because of an understanding, let me say, governance system we have had here. We have had a very supportive board, hospital board. The management has been selfless. Patients have been faithful to us. We have maintain the faith. We have kept the faith that God is king over here, and that faith has kept us going all this time. We are happy that the direction we are taking is right, and we are proud that at 100 years, if the founders were to attend the centenary celebrations in October, I am happy to say they would be proud with what they would find at PCEA Chogoria Hospital. That is despite the challenges we've had with COVID and all that. Thank you.
Number ones we are saying, we would like to compare with other internationally recognized hospitals, and we know that is possible, and we know it is being done because we have lots of specialists, very committed staff, committed nurses, people in the diagnostic areas, and even in radiology, in X-ray department, the laboratories, and even those who care for the patients at other levels. I want to say we also want patients to be very safe, and therefore we care for safety. The second thing that we have focused on is customer experience. What we are saying is that those who come for services here, we like them to go out there and be able to testify that the PCEA Chogoria Hospital is a place worth seeking services from because of the commitment we have given to our clientele.
I'm excited because nursing in the early 50s, they were referred to as dressers. They were people to come and dress with. But now, we are able to do specialized care in our services. We are very, very excited because I've seen and I've heard stories about how nursing used to be practiced then. In terms of infection prevention, nurses never used to use gloves, but these days they are protected. You can see nurses are given personal protective equipment to be able to protect themselves as they serve. Previously, they used to use bare hands, the protection was not there. As we speak, initially the nurses used to carry the bodies to mortuary, but now as we speak, the hospital systems have grown and we have people designated to work in mortuary. So as we mark these 100 years, we are very excited to see even the government able to support and set policies to support nurses, policies that are there to assist nurses to grow up and to support them to do their work. Even as a hospital, we have policies that support nursing department, and it's very, very exciting because the nurses feel protected. They have their rules and regulations. These days, nurses can get their CPD points through the Nursing Council portal. They learn online and they can be able to get the CPD points, and they are able to license themselves online. Previously, a nurse had to travel from Chogoria to Nairobi to get a practicing license. But these days, as we mark these 100 years, we are able to do it online, and within no time on your phone, you can get your practicing license. So I think the generation has been good. We may not be there 100 years to come, but I hope I will be able to carry on this practice and making the life of nurses better. Thank you very much. PCEA Chogoria Hospital, caring with love.
Then the thematic area is what we call institutional capacity building. Institutional capacity building in the sense that there are many capacities that are required in order to meet clients' needs and expectations. One of them, and very important, is the human resources for health. We're talking here about the personnel trained specifically to give care to the sick, to give care to those who seek our attention. And therefore, we are talking about giving good capacity, improving our nurses in terms of their knowledge, in terms of their attitude, in terms of their skills. That includes the doctors, the laboratory technologies, and all those that work with them in those areas. The capacities in terms of diagnosis in the labs, X-ray department, and all the other departments where we are likely to take specimens so that we get the best diagnosis. That's the capacity we are talking about.
Hi everyone, my name is Miriam Gitonga. I'm the HR and Administration Manager here at PCEA Chogoria Hospital. I'm delighted to take this opportunity as we celebrate our 100 years of being in existence as PCEA Chogoria Hospital. It has been a long journey, and the journey that has seen us be where we are right now. As PCEA Chogoria Hospital being 100 years means that we have grown in strength and bounds, and this includes the workforce. Having started with Dr. Clive Irvine, who was a main missionary, the founder missionary of PCEA Chogoria Hospital, to having more than 8 consultants within the hospital means that we have grown, and we are delighted to see that the hospital is able to now serve the community in terms of specialization. The human resource aspect oversees each and every issue to do with employees, and being the head of this department, we work in collaboration with other heads of departments, and we work in ensuring that our employees and our staff base is highly motivated in ensuring that we manage the employees and also achieve our strategic objectives. PCEA Chogoria Hospital offers specialized services, and we are tasked in ensuring that we provide the health workforce within the hospital at the right time, and ensuring that this health workforce is provided on time and is highly motivated within the time that they are working, and is able to be provided with each and every equipment and everything that they require to be able to provide these services. We appreciate the growth that the hospital has seen within the 100 years, with the support that we have seen from each and every stakeholder within the community, within the government, within even the staff base, and at the church level. We appreciate the partnership and the provision of functions that have enabled the hospital to grow into the 100 years that it is celebrating. With this, we want to say that the health workforce within the hospital are the key aspect and the key aspects within the hospital that is able to provide these services. And without the health workforce, without the staff, we are not able to serve as we are required to be. So as part of our function is to provide timely workforce, is to provide, to retain the employees within the time that they are working, and to ensure that they are able to support the hospital in driving itself to achieve its main mandates. So, with the growth that the hospital has seen, I wish to appreciate the role that each and every person that has passed through the hospital from the time it was founded up to the time that we are celebrating the 100 years. I wish to appreciate each and every one of us and each and every person that has seen the growth of this hospital to what it is today. The clinical team, most especially, has enabled us to grow in health and bounds to see the hospital achieve its referral status. We have seen partnerships with secondment from the county government, even the national government. We have seen the role that the missionaries have played in ensuring that we achieve this main mandate of attaining the referral status that the hospital is today. We look forward to celebrating these 100 years, and we look forward to even jumping into the next century of existence of the hospital. And the hospital has set up plans within its strategic objectives in ensuring that we are seen as a hospital that is offering specialized services. And with this, we have quite a number of departments that support this main mandate. And in the structure that is today, we have functions ranging from finance, functions ranging from nursing. We have a stable nursing department. We also have functions ranging from chaplaincy, where we have grown in collaborating with the chaplaincy team in ensuring that we offer wholesome spiritual services while offering clinical services to our patients and to our staff and also to our students in the College of Health Sciences. And with this collaboration and with this partnership that we have seen within the departments, within the hospital, we have been able to stand out in comparison with other service providers within the region, within the country. And as we celebrate the 100 years, I wish to indicate that we have a strong staff system within the hospital. And with this staff, the hospital has instituted measures in ensuring that the hospital are well taken care of. We have a welfare scheme that supports the staff whenever the need arises. We also have a strong medical scheme that supports the staff whenever there is need. We have also seen staff trained whenever there is need, especially this time that we have seen the emergence of COVID-19. We've also ensured that the staff is well motivated in ensuring we've instituted measures within the hospital to support staff in motivation. And with these aspects and others that may not be mentioned right now, the motivation level of the staff has seen growth and has seen support from the staff. The staff has been able to, in turn, offer efficient and effective services for the patients within the community and within the region, and that is why the hospital has grown to what it is right now. We look forward to partnering with all the stakeholders, including our employees, including the community, including the church, including the county government, the national government, in ensuring that we give timely services, quality services for the patients within this region and out of the region. And that is why with the strategic objective for the next 5 years is to ensure that we achieve specialization and offer the right and quality services on a timely basis. We wish to appreciate all the staff that has been within the hospital and is currently within the hospital. And with this, we wish to welcome anybody that is willing to partner with us in terms of offering services. We have system of recruitment that is open and fair, and we welcome every person within the region, within the country, to partner with us so that we can be able to reach our mandate of ensuring we offer these quality services as is our strategic objective. We partner with quite a number of departments, as I said earlier, and these departments have been placed in and has the right employees who are skilled and who are motivated in ensuring that we offer the services as we have plans. And thank you to everybody that is partnering with us. Thank you to all our stakeholders. Thank you to the church, the PCEA Church, and we also thank the government and the national and the county government because of partnering with us in ensuring of our community health services within this region. Thank you very much.
Infrastructural and equipment areas. Allow me also to mention that PCEA Chogoria Hospital is also a training facility for nursing, and we are expanding that to go for specialized nursing training. That is at the college, the Clive Irvine College of Nursing. This Clive Irvine College of Nursing has been transformed quite a lot. In the recent past, again, we had a partnership with our partners, and we've been able to put a facility for accommodation, and we have started with accommodation for the girls, ladies, and we are looking forward to putting up more facilities in order to accommodate the boys, because it's also good to ensure that we have a balance and we don't leave the boy child behind. As a result, therefore, the College of Nursing, the College of Health Professionals training is being improved as we continue, so that in due course we think that we should be very competitive, and we would pray and ask the members of the communities around us to take advantage of this new opportunity where we have introduced new training areas, so that our community is advanced in terms of healthcare professionals, and so that when we look for people to employ in the hospitals, then we will have people who can come and work here. And beyond that, we train because we want to be able to meet some of the sustainable development goals, where we have said that healthcare is given priority. Healthcare is given attention that is important, so that in the community there will be a good ratio of healthcare professionals to the population, the right ratio of doctors to the population, the right ratio of nurses to the population, and so on.
My name is Jimson Kibenji. I'm the principal tutor for Clive Irvine College of Health Sciences. And this is one of the departments of the hospital that is mandated to do training for healthcare providers. Our college has been there for quite some time. It was established in 1950s. Actually, it came like 30 years after the hospital had been established. And when the college began, it was training nursing assistants. And over time, the college was able to transform and started training nurses. And then fast forward in 2019, we opened our doors for other healthcare providers, and we introduced courses in data technology, health records, community health, and also data technologists. And as of now, our population stands at 323 students. These students, some of them are usually accommodated within the college, where the other group of students usually live outside. The vision of the college is to develop and qualify responsible, competent, spiritually and morally upright professional healthcare workers. The core values of our college are God-fearing, integrity and stewardship, professionalism, diligence and innovation, and finally, evidence-based practice. As you all know, our college is mandated to train healthcare workers. We always seek to develop healthcare workers who are compassionate, and just as our motto says, caring with love. College is known to offer high quality training for healthcare providers, and over the many years that we've been in training, many nurses have been qualified, and they are working nationally and world over. Besides the good education that we offer to our students, we also focus on the psychosocial aspect of our students. We have a very vibrant chaplaincy and counseling department that provides counseling and also psychosocial support to our students. Looking back, our college has been able to achieve a number of things, and one of the greatest things that we pride ourselves in is having trained thousands of nurses who are currently working in various hospitals in Kenya and world over. Another big milestone that we've been able to make as a college, broadening the scope of our training. Previously, we only used to have a diploma in nursing, but currently we've been able to add 3 additional courses, that is data technology, health records, and community health assistant. We've also been able to have a major infrastructural development for college. Previously, the boarding capacity of our college was at 95 students, and I'm proud to report that as of now, and with the help of our partners, we've been able to increase the capacity to 185. That shows a 90% increase boarding capacity for our students, and our students, majority of our students are able to be accommodated within the college. I would like the general public to know that our college is fairly affordable, and we always endeavor to make sure students from the very most needy backgrounds, they are also able to achieve their dream of tertiary education. I'm happy to report that our students are able to benefit from loans from higher education loans board, and the majority of our students, close to 60%, usually beneficiaries of help. Besides higher education loans board, our students, we've also been able to establish a scholarship with the help of our partners, Medical Benevolence Foundation. We've been able to set up a scholarship fund that has helped quite a number of students finance the education. During my work here in Clive Irvine College of Sciences, I've come to the realization that partnerships are of great importance because for sure I've seen our college transform in a big way. And one of the key things that have happened in our college, construction of a modern addition block which has a capacity of 90 students. In my course of work here in Clive Irvine College of Health Sciences, I have come to the realization of the big impact that institutions can have in partnerships. And as you all know, PCEA Chogoria Hospital is a mission hospital that was set up by the Scottish Missionaries who planted a hospital, several schools, and also the church. And from those early times, partnerships had huge impact to our communities. Even as we speak today, partnerships continues to play a big role towards development of our institution. In partnership, our college has been able to build modern addition block. Many people wonder why our college is called Clive Irvine College of Health Sciences. We made the decision to name our college that particular name in honor of Dr. Clive Irvine, who was one of the pioneer missionary doctors who helped set up the hospital. As a community, we will always be grateful to this selfless doctor who came from Scotland to come and give our community light through healthcare, education, and also Christianity. As we mark the centennial celebrations, our college is poised towards greater heights. We would wish to carry on the good works that have been happening to the next generation. In our strategic plan, we've been able to outline a number of things that we wish to do in the next century of existence, and some of the things include introduction of higher diploma courses in healthcare. Also, we would wish to expand the infrastructural capacity so that our college can be able to attract more students and give them the needed ambience for learning purposes. We would like to thank God for the many milestones that we've been able to achieve as an institution. For sure, an institution being there for 100 years takes the grace of God. I would also like to call upon like-minded partners to come and join us in helping continue the great work that is happening in Chogoria. I would like to thank the management of PCEA Chogoria Hospital, led by our very able CEO, Madam Catherine Munene, for the good guidance and the good leadership that she has been able to give to this institution. I would also like to thank Hospital Board for the good counsel and the good support that they always give us. Forever we will be indebted to them for the good work that they always do.
And while at the training, I want to mention that PCEA Chogoria Hospital is a recognized training center for College of COSEXA, or what we call the College of Surgeons of Eastern, Central and Southern Africa. It is the COSEXA program where we get doctors come here to train in surgery, and they spend time so that they become fellows of the College of Surgeons, East, Central and Southern Africa. I must say therefore that places Chogoria Hospital among the few teaching hospitals in this country. Alongside that, we also have partnerships with universities, and we have a training program for family physicians. Again, that tells you that we have a lot of partnerships with healthcare professionals and doctors from the US, from Europe, and with local universities that offer the training for family physicians.
My name is Derek Weber. I work in the casualty department here at PCEA Chogoria Mission Hospital. I've been working in the casualty department for a number of years. A few years ago, we did a larger expansion of our emergency department, our casualty department, to be able to increase the capacity of patients and the volume that we see. Some of the things that we specialize in our emergency department is to be able to provide emergency care within the first 24 to 48 hours for our patients who come. A number of the patients who come display issues of blood infections, high sugars, blood sugar levels, high blood pressure levels, and so we can be able to adequately manage these patients and the immediate circumstances that they bring into us. We also see a number of trauma patients from the road traffic accidents that we see in our community. Emergency medicine is an issue that we face all throughout Kenya. And because of that, we are bringing in a high level of care through our standard staffing of clinical officers. We are also able to offer medical officers, consultant coverage, and even family medicine resident coverage within our casualty department. We are seeking to expand our services to be able to provide training for our clinicians who can be able to expand their medical knowledge in emergency care techniques and information. We also allow our continuing medical education to go on within our casualty department each week. We are expanding our training to include advanced cardiac life support, basic life support, and pediatric life support. We seek to triage and appropriately intervene in our patients who come to casualty. We do this with the highest level of care and compassion. We seek to be able to refer our patients to our inpatient doctors or our ICU clinicians to be able to provide the appropriate level of care. We also can be able to transfer our patients out. We have patients who need further services. For our patients who come into our casualty department, we seek to be able to provide compassionate care with love, caring with love.
May I also mention that we really value partnerships, because in all this we cannot develop alone. We need good partners, and I must say that this hospital has very good partners. I may not be able to mention all of them, but there is a group called the Friends of Chogoria, and that is a group that is planning and has been planning with us so that we can look at any areas of development, the infrastructural areas, the infrastructure, equipment, and so on. We have other organizations like the Africa Health Network, the AHN, that has partnered with us in the area of renal care, that is dialysis and renal care for diseases of kidneys. We have partnered with other institutions that have helped us to develop the theaters, and I must say even in the placement of the CT scan and MRI, again we have had partners, we have partnerships that are very, very, very useful, and that will ensure that our equipment do not have any downtime, because we are able to make sure that the maintenance, the preventive maintenance, or what we call planned preventive maintenance, is carried out in a manner that we have no downtime or equipment. I must also remember that another thematic area has been the spiritual and holistic care. When we say spiritual, we are saying when patients come here in those low moments, again, they have pastoral care. We have a department in the hospital that is able to give them pastoral care. That is, they are able to do evangelism, they are able to give them pastoral care. And for those who, if in the event there is any issue and patients pass on, again, they get support from the hospital, chaplains and departments that is able to work with the families and the relatives of those who may have departed, while at the same time dealing with those who are recovering, and they are able to do follow-ups into the community. And we are very happy because we are linking up the community, the hospital, and making efforts to make sure that the patients who are to be followed up are followed up, and we don't lose patients for any reason or the other.
Chaplaincy department is one of the departments in the hospital which is dealing with the spiritual matters. Otherwise, we also call it a spiritual ministry because we are dealing with the spiritual matters concerning patient, staff, and students in this hospital. So far, we are one chaplain and we have 6 evangelists who work in, let's say, full-time basis, and generally we do give our service to the patient who comes in this facility to seek help, and as the doctor treats them or gives them medication, we are sometimes going to chip in when we realize that or doctors realize that the patient has spiritual issues, and we do that together with our psychology people. We have a psychologist here, and we have others who deals with the different issues which sometimes are complicated. They don't need medication, but the patient is sick. And so far, we do the bed-to-bed counseling. We do the bereavement counseling also. We pray with patients early in the morning in their wants, and we also pray in the unit. And also, wherever patients come for their beloved ones who are passed on, we also go, we attend them at the morgue. Generally, we attend our students. We give them counseling and also support wherever need arises. We also move sometimes outside to meet with the community, because also we have people who comes for the service on Sundays. They are part of us, so we also reach them wherever need arises or wherever we get a chance. Chaplaincy department, so far we have grown because when we look at the numbers of those people we attend, they have grown because we also distribute Bibles to those whom we preach to and get converted. We distribute Bibles to them. So we have seen the chaplaincy department growing, and so far we can say we are somewhere, and we are growing. Let me say, so far we want to strengthen the department so that we can have Bible studies. We can also want to marry that idea of Samaritan solution. There are people who came with the idea of saline process, where we feel that every person or every caregiver in this hospital has spiritual, let's say, knowledge, so that when somebody is attending patient, he also gives them some kind of encouragement, spiritual encouragement or spiritual support, instead of waiting for whatever or when chaplains are around. If somebody gets an issue which is challenging and is spiritual, we want every caregiver to have some knowledge. Also, we want to reach our people outside, and we feel it will be part of us. Also, we feel so far we have been blessed with the partners. We have BF who have been supporting us with donations, where that we are able to do few activities using those donations, and especially wherever we want to go for outreach or training. We also have a Samaritan Pass who are supporting us with the Bibles and also funds to pay our evangelists, some of them, and we are looking forward also to get more donors or partners who can assist us in other areas areas as we grow. Let me say for the 100 years we have been in this working, or we have been serving, we have seen the grandsons. We have grown from one evangelist who used to serve this hospital to 6. We have been able to spread our services in the entire hospital, and not like when we used to just wait wherever problem arises, we just attend that the problem, then there is no more. We are continually giving different types of services to our patient who comes in this hospital. And let me say, so far we are looking forward now that to grow and also strengthen our services so that we can do even more. We can reach a point where none of person who comes in this hospital goes without being attended in one way or another by our department. So far, let me say, we have seen the hand of God working and serving this hospital through chaplaincy, and we have seen people who have given testimonies outside there who really comes to the hospital because they were prayed for and they were assisted and they got well through chaplaincy department. And we can cite a few miracles which God has performed in this hospital. There is another lady who came here and she was going to commit suicide, and she was from outside and she went looking for somebody outside even the hospital who can assist her because she felt that she had reached the end of her life because of the problem which she was undergoing. But when she met the chaplains and they prayed, she was able to stand, and she was pregnant and she gave a birth to a very healthy boy. And she praises God for Chogoria because she says that if it were not the Chogoria chaplains, she could not be alive today. Let me say, so far so good. We are looking forward even to do more for our people. We want to reach our people. We want to assist them, and especially those who are having challenges. And especially at this time, we can see many families, we have social, political, economical problems all over. So we need to chip in and assist our people so that they can continue living. That is our dream. That is what we are focusing on. And that is what I can say about chaplaincy. So far, let me say, PCEA Chogoria Hospital, caring with love.